All right. Knock, knock, knock. Hello, my name is Whitney. I'm going to be your nurse for today. Let me go ahead and wash my hands. All right. Can you tell me your full name and date of birth, please?
My name is Janiyah Evans. I was born July 19th, 2008.
Okay, perfect, Janiyah. So today we're just going to do an assessment. I'm just going to do like a full body, just look you all over, and just kind of get a baseline on where you're at. So is that okay with you?
Yes.
All right. So I'm just going to ask you a few questions right now. Do you know where you are?
I'm in the hospital.
Okay. Do you know who our president is?
Joe Biden.
Can you tell me what today's date is?
8/24/2021.
Perfect. All right. So are you having any pain right now?
No.
All right. So now I'm going to go ahead and just collect some vital signs on her, get a blood pressure, get her temperature and heart rate. All vital signs are normal and stable. Okay, so now we're going to start our assessment. I'm going to go ahead and I'm going to just look through your scalp, feel around your head, feel any lumps, look for any lesions. Come down, look into your ears now. I'm going to check your ears. Okay, that ear is clean, normal drainage and intact. Eardrums intact, clean, normal drainage intact, no lesions. All right, so now we're going to go ahead and do your eye assessment. If you want to remove your glasses for me for just a second. I'm going to be shining this light on each side of your eyes. Okay, perfect. All right, good. So now, without moving your head, just follow my pen light, okay, with your eyes. Okay, perfect. Okay, so pupils are equal and reactive to light and accommodation. So now I'm just going to do my peripheral vision assessment. So I'm just going to have you read the numbers. Don't look down at my hands. Just tell me what numbers you see.
2.
Okay.
1.
Perfect.
3.
Okay, good job. All right, so now we're going to go ahead and I'm going to look into your nasal nares now. So if you go ahead and close up one side for me. Okay, can you take a deep breath through it? Okay, are you breathing okay?
Yep.
All right, and I don't see any obstructions or lesions on that side. Can you do the other side for me? Breathing. Okay. Any trouble breathing on that side? Okay, now I didn't see any obstructions or lesions on that side as well. All right, so now we're gonna go ahead and move down to your mouth. Can you open your mouth for me? All right, so I'm looking inside at the mucosa and the buccal. It's pink, it's moist. Can you stick your tongue out for me? All right, say ah. Uvula is intact. Tongue is midline. All right, so now we're gonna go ahead and I'm gonna have you close your eyes for me. All right, and can you tell me, what do you smell?
Alcohol.
Okay, good. All right, and then I'm gonna go ahead and I'm gonna have you shrug your shoulders up for me. Okay, and down. All right, so all the cranial nerves were tested and they're intact. All right, so now I'm just gonna feel around your neck now, feel for any lumps or mass or anything like that. Check your carotid arteries. One on each side. All right, now I'm gonna check your thyroid. Can you swallow for me? Okay, perfect. Thyroid is intact. All right, so now we're gonna go ahead and I'm gonna listen to your heart now. So I'm gonna listen to the second intercostal space. Start with the aortic. Okay, move over to a pulmonic. Okay, and then you have the Erb's point right here in the middle here. And then I'm just gonna come all the way down to the fifth intercostal space, and midline to the chest, and I'm going to listen to the apical pulse for a full minute. All right, so the heart rate is 90, normal heart sounds and strong. Okay, so now I'm gonna have you sit up And we're going to listen to your long sounds now. All right, so take a deep breath, in and out. Another deep breath, in and out. Another deep breath, in and out. Another deep breath, in and out. Okay, another deep breath, in and out. Okay, one more deep breath, in and out. All right, so now I'm gonna have you go ahead and sit back for me. Long sounds are clear to auscultation in all fields. All right, just gonna go ahead and move down to your vowel sounds. Can you tell me the last time you had a vowel movement?
This morning.
Okay, and it was normal for you?
Yes.
All right, so we're gonna go ahead and I'm just going to listen to her vowel sounds. I'm gonna start with the right lower quadrant. Okay, right upper quadrant. Okay, left upper quadrant. Okay, and left lower quadrant. Okay, and I'm also going to palpate around, and then you tell me if you have any pain. Okay, patient is not having any pain. So vowel sounds are active in all quadrants. I listen to each quadrant for about 10 to 15 seconds. Okay, so now we're going to just go ahead and we're going to look over your arms and your legs, check for any swelling or edema. At this time, I will check her pulses to see if they're equal on both sides. So I'll check her radial pulses. Okay, on both sides, they're equal. I'm gonna go down and I'm gonna check her dorsalis pedis pulses on both sides, and they're equal. And there is no swelling or any changes in skin color or anything. I'm gonna check her capillary refill on her toes. Okay, capillary refill is brisk, less than 3 seconds. I'm also gonna check her capillary refill in her fingers now. And that is also brisk, less than 3 seconds. All right, so now I'm just gonna have you test your strength. Can you squeeze my hands for me? Okay, good. And then can you push on my hands for me? Perfect. All right, and then I'll do the same thing to her lower extremities. Gonna have you push down. Okay, perfect. Now pull your feet to your chest. Pull up, no, pull your feet up against my hands. Okay, good. So her extremities are strong, and upper and lower extremities +5. So that will complete our assessment. Do you have any questions for me?
No.
Okay, thank you.